Are we on? Good morning, good afternoon, good evening, everyone, depending on where you are listening to us from. You're tuning in to the webinar, the CGIAR effort to support countries responding to COVID-19, how we did it, and lessons learned. My name is Ewen Leborgne. I coordinate knowledge management activities for the CGIAR COVID-19 Hub. This is a final webinar, and as it were, the last public engagement act of the Hub before it folds together with the second COVID-impacted year. On January the 1st next year, the Hub will no longer exist, and the change process leading to CGIAR centers all uniting under a common One CGIAR banner will be a fact. Meanwhile, of course, the pandemic is still very much in action, and CGIAR will keep on providing its support to national governments in finding answers to the exacerbated food, agriculture, and nutrition issues that communities around the globe are suffering from under the coronavirus pandemic. So this is a very good time to look back at what the CGIAR COVID-19 Hub has managed to achieve since September 2020 and what lessons it brings forth for One CGIAR and the planet as a prototype of rapid response to government's interventions. You might be wondering what the CGIAR COVID-19 Hub is. It has been established with donor support to allow the CGIAR to contribute a coordinated response, of which one component involved engaging in selected countries to support national efforts. This component of the COVID Hub viewed this as an opportunity to explore both what the CGIAR can contribute in such an emergency situation and how we could identify priorities together with national stakeholders and so work towards one of the objectives of the One CGIAR to strengthen its partnership strategy. Today on the webinar, we will be listening to representatives from the national teams involved in the CGIAR COVID-19 Hub about the work they undertook and the results that this brought forth in the 5 focus countries, namely Bangladesh and Myanmar in Asia, Ethiopia, Malawi, and Nigeria in Africa. We will then also listen to partners working with the CGIAR country teams about some of their reflections on their experience and on what they have learned and would recommend One CGIAR focuses on going forward. We will also invite you among the audience to share your questions for our partners, and we'll have a brief closure with the overall coordinator of the Hub, John McDermott, who is also the director of the CGIAR Research Program on Agriculture for Nutrition and Health, a program which is also closing at the end of this year, as John himself takes a bow out of CGIAR and retires. So stay tuned for this exciting program, and let's find out what a COVID Hub had in store and what this boiled down to. And for those of you who could not follow this webinar today, we are recording it and we will be sharing it on the COVID Hub page of the website of the Agriculture for Nutrition and Health program website, as well as on the www.cgir.org website. So without further ado, we're going to proceed with listening to the presentations from our country teams, what happened in their program and what lessons they have learned in the process. It's going to be 5 short presentations, one by each of the country teams, and then we will continue with the partners. So starting first for Myanmar, we are going to have Nuong Tran, who is going to present us the results from Myanmar. Over to you.
Thank you, Owen. Good morning, good afternoon, and good evening, wherever you are. So let's start with the Myanmar COVID Hub activities. So core team of our program consists of CG Center having office in Myanmar, including One Piece, IMID, IRI, and IFRI. And next, please. Our work plans consist of 2 work packages. The first one is investigating impact of COVID-19 on agri-food and fish value chain in Myanmar. This one, they engage One Piece, IFRI, Myanmar Fishery Federation, Greenway Myanmar, and also Department of Fishery at the local level. And the second work package investigate the impact of COVID-19 on women agribusiness and fish value chain in the Gulf of Myanmar, the specific point in the southern part of the country. Next, please. So the key highlight of the work package 1 consists of 2 sub-activities. The first one is urban and rural food security survey implemented led by IFRI. This is implemented in the Myanmar Country Support Program, which ran from last year, 2020, and to September. Altogether, it's 9 rounds of surveys. So the key highlight of this package is that Myanmar has experienced serious economic shock since 2020, and the most recent shock is the spread of the Delta variant of the COVID-19. 60% of respondents stated that at least one household member experienced COVID-like symptoms. And also there's rising physical insecurity has emerged resulting from the impact of political instability in the country. And more respondents find the problem related to food supplies and also the loss of jobs and incomes, and with travel restrictions intensifies. And highlight of this study also shows that job loss has been extremely high in 2021. Income-based poverty remained high among migrants. And for the first time, the study team observed trends in adequate diversity among children, a very high rate of inadequate diets. In all samples, was steep rising inadequate between 2020 and 2021. And stakeholder has taken different mechanisms to cope with the COVID and shocks, including cutback on expenditure and sold assets, among other things. Next, please. And for the second pack of work, we focus on the fish value chains. Among the stakeholders we interview and study, including fish trader, fish producer, and fish mill, fish hatchery provider. So the key finding from this part of study is that the COVID impact has been intensified, more severe in 2021 compared to last year. This also resulting from the prolonged pandemic and stricter measures implemented by the government and community to contain the virus. And we observed sales of farm fish dropped significantly. The quantity of processed fish sold was increased in this year compared to last year, maybe resulting from the travel restriction. And also the diverse of fish products with the price lower than last year. And similar to the food security survey, respondents also find different coping mechanisms to build recovery and resilience. However, these are among the short-term, like borrowing, using saving, and buying input on credit. Next, please. And this highlight from the second work package, which is focused on the agri-business run by women along the fish value chain in the specific place in the Gulf of Motomai, the southern part of the country. And this study also finds universal impacts across stakeholder nodes, including transport difficulties faced by stakeholder, access to credit problems, limited access to bank savings, and reduced access to releases for NGOs, so that you have a restriction on implementing assistance support to the community, and also increasing debt burdens, reduce expenditure and food consumptions. And the impacts has differentiated on the class and stakeholder groups, like the poor is versus who has more saving. So it's a differential impacts. And also there's implication of the livelihood, portfolio diversity, and migration. People will keep poultry, for example, can have a better access to household nutrition income. And yeah, the study find limited gender differences among the nodes. So there's need to continue to observe the gender's impacts of the shock. Next, please. So lessons we learned and recommended actions. The first one is the stakeholder development organization need to scale up and sustain assistance to Myanmar to support the poor and then vulnerable communities. And further monitoring of the situation in Myanmar will also be critical. And the second part is what coping mechanisms implemented by the respondent are somehow short-term, and the long-term support is required to develop more resilience and sustain in the long-term future. Something like invest in human capacity and skill development through training programs, or providing educational program and training for fish value chain actors specifically, especially in rural areas, to improve their computer literacy skill to facilitate online transactions to cope with movement restriction, and long-term intervention to boost employment and income can be more comprehensive of social protection and public health care to be the key to develop more resilient livelihoods and food systems for the country. Thank you. This is the center taking the lead in Myanmar. Thanks. Over to you, back to you, Owen.
Thank you very much, Nuong, for this very clear, very concise presentation, also setting the mark for our follow-up presenters. By the way, if you are in the audience and you have some questions, you may use the chat box to leave your questions, and we will try to answer these during the webinar. Meanwhile, just informing you also that we are following actually the time zone. So from Myanmar, we're going to move to Bangladesh, then to Ethiopia, Malawi, and Nigeria. So for Bangladesh, we have Tarayil Amjad Babu, who will be presenting us the results. Take it away.
Thank you so much, Ivan. So welcome to the final webinar on CGIAR COVID-19 Hub. My name is Amjad Babu. I'm the country coordinator for COVID-19 Hub country level actions in Bangladesh. So it was a complex and rewarding journey with COVID-19 Hub. So let me explain some of the outputs and reflections from what we have done as a part of this program. Can you go to the next slide? So COVID-19 Hub project had a distinct developmental process for the intervention plans. We have done a very detailed demand assessment for interventions. We try to match it with the supply, what we are trying to do, considering the supply of even other organizations. So we had detailed discussions to prepare the intervention plan. We considered multiple factors, including the comparative advantage of CG in supplying these interventions, and also the leverage points and the budget what we have. So given this intervention plan, we have carried out the work with the adaptive co-design process with the stakeholders, always modifying the plan according to their requirements. The same philosophy we have followed in the execution level also. So we followed this process and developed the intervention plan. Can you go to the next slide? So we have developed a complex and detailed intervention plans to support and build COVID-19 resilience building, especially for developing food and nutrition security in the country. It had 4 distinct thematic areas which we try to build our interventions, and most of them were digital interventions because given the time and resources and other limitations, also their larger outcomes given the budget. So in case of the first thematic area, this disease intelligence and for resilience building, we developed digital disease monitor that can actually track disease data for crop disease and for fish mortality. Also, we have developed a digital monitoring system. So the next thematic area was COVID-19 and farm stresses, which you have observed is rapidly changing, and the organizations, especially development partners like Department of Agriculture Extension, is having trouble in identifying these stresses very rapidly. So we have developed different systems targeting to identify these stresses. One important one was farm stress monitor, which is actually gathering intelligence from all the department, all around Bangladesh, which is all sub-district level, using the officers of Department of Agriculture Extension. And also we have used satellite data to track the crop growth and its health and so on. And we have done some initiatives for Department of Marketing that can help them to track down the prices and forecast the prices. Other major thematic area was women on COVID-19, and we have done two major initiatives, that is a nutritional secure homestead application and a study on digital market for digital entrepreneurs and producers. Another major thematic area was the extreme weather and its interactions with COVID-19 stresses in Bangladesh. So for tracking down, we have developed different systems, which is satellite based on weather, gridded weather data-based monitoring systems. So many of these, for many of these intervention, Department of Agriculture Extension was the beneficiary. So our representative, Mr. Azamuddin, has joined already here with us. Can you go to the next slide? So I'm happy to say that given the limited time and the major procedure complications, we are able to deliver major outputs. We have developed an extensive system of the satellite-based monitoring system, for example. So that's International Water Management Institute has developed crop monitoring, drought monitoring, flood monitoring, satellite-based monitoring system. This is already, we have trained DA officers to use this, so they can actually compare different scenarios currently and compare to last year or years before, and see what happened and what is the actual situation in case of crop growth or a drought situation or flood. So they are able to identify this in a quick time, because this requires only a few clicks to get this GIS-based analysis done, rather than which were taking them months to do even a single analysis. And it was also supported by Farm Stress Monitor, which was actually linked to mobile applications installed in all the DA officers at sub-district level. So they are actually able to report any farm stress, including seed shortage or fertilizer shortage or labor or irrigation issues. All these issues can be reported to a centralized database, which can be monitored by the DA themselves, and which can also be linked to other systems. So the fish and crop disease, fish mortality monitor was for Department of Fisheries, and crop diseases also aimed at Department of Agriculture Extension, so they can also track what's happening, in the crop diseases, what's the dynamics. Using their own extension officers, we have given extensive training for almost 1/3 of the country so far. And we have also looked at the forecasting data, and we have also a monitoring system, so that they can also look at near future what's going to happen within the country for different agriculture crops, given the weather forecast, and act accordingly. So all these interventions are near-time monitoring systems that can build resilience capacity to any kind of stresses, including COVID-19 pandemic. And the last intervention, which I want to highlight, there are many other outputs which, for the time shortage, I'm not presenting here. But in case of mobile application for nutrition homestead, what we try to do is to leverage the $0.5 billion project of DAE on homestead gardens. So what we are trying to do is, we are trying to redefine homestead according to the nutrition deficits identified within this diet data, using the diet data of households. So this mobile app is capable to look at, find out what are the major missing nutrients in their diets, and suggest crops that can actually fulfill these deficiencies. Can you go to the next one? So given all these outcomes or outputs, what we can say that the project demonstrate One CGIAR can offer more than some of its parts, because I'm sure that without having the group supporting each other, we cannot obtain this kind of results within a short time frame. So I think that collaboration was very successful, and it's a model for One CGIAR. And we have creatively used the existing assets and let be country level, regional level, global level experience, and we are trying to leverage it for larger outcomes. And the approach which we follow, the demand assessment, intervention plan, and co-design of projects, is definitely can work, but it can require adjustment based on specific country conditions. So that's one experience we want to share. And all these are, we can call it digital enabling interventions that's oriented towards institutional actions. Normally, we have worked a lot on farmer-oriented interventions, but in COVID Hub, we have, we are looked at institutional partners, especially government agencies, who can, we were trying to enable their actions so that larger outcomes can be realized in building resilience towards disruptive events like COVID pandemic. And also beyond pandemic, I should say, because all these systems they can use and realize outcomes even if there is no pandemic or after pandemic. These digital tools can be useful, and we have focused on their low operational costs, especially for sustained use. And we are sure that sustained efforts are required for building, the momentum we have created already. And we are looking at there are 16 One CGIAR initiatives potentially will be operating in Bangladesh in coming year. So we are looking at how can we actually reach these 1 CG interventions right here in Bangladesh. So we have some good outcomes so far. Can you go to the next slide? Yeah, this is our COVID Hub team. I'm thankful to everybody here so that it made a wonderful work together, and we have attained most of the outcomes what was promised under COVID Hub. Thank you so much.
Thank you very much, Amjad, indeed. And just a couple of informations. One is, I think, for the audience. In fact, I think if you have a questions, please use the Q&A feature, not the chat box. Also, for the presenters, we're going to move away from Asia into Africa, starting with Ethiopia. And I'm just giving a heads up to the presenters when I'm going to disappear, put my camera off. But when I come back, that's a signal that it's time to wrap up. Otherwise, we're going to have too little time to hear our partners. Thank you so much. Getachew, over to you.
Thank you so much. I'm Getachew. I'm presenting on behalf of the Ethiopian country team. Next, please. Ethiopia has seen increased production of staple crops for the last years, but this production of increasing production was not as such. It has a problem of productivity and diversity and the need to improve. One of the challenges was the seed supply, and we observed that the pandemic has caused disruptions in input supply chains, especially on the seed systems. And we also observed that there was misinformation against consumption of vegetables, meat, and other related foods at the start of the pandemic. So we proposed digital-based solutions to address these interlinked challenges while facilitating contribution to the Digital Ethiopia 2025. Next, please. When we started the project, we started with evaluation analysis of the demand and the supply sides. The demand sides was the government of Ethiopia priorities in response to the COVID pandemic. And we also analyzed and we tried to look into what has been supplied by the CGIAR and other centers. And we framed our research questions based on this demand and the supply analysis. And after the demand and the supply analysis, we came up with 3 major work streams and 1 coordination work stream. The first one was understanding the nature of input supplies disruptions. And in this, we did mapping seed systems and identified critical functional points for digital solutions. At the initial stage, when we did the mapping and assessment, we focused on 1 staple that is wheat and 1 vegetable, onion. We did this because of the time constraint and also the budget limitation we had. But this one was changed at the end of our exercise. We had to scale it up a little bit. And the next area of intervention was the misinformation challenge on diets. As the start of the pandemic, we tried to do a kind of assessment on the types of misinformation and the types of messages that have been transmitted in the country. And finally, we developed recommendations on digitalization with proof of concept. So with these three main work streams, we have one coordination work stream that was led by Ilri. And the task of this coordination was to do consultations, organize meetings, and for reporting purposes. Next, please. On highlights of the project outputs, the first output was we conducted sea systems mapping and impacts, and the report is ready for publication. And based on the recommendations from this mapping and impact assessment, we developed seed systems digital platform for all crops. I said that we initially started with wheat and onion, but at the end of the day, looking at the demand from the government side and the nature of the problem, we developed a digital platform that serves all cereals, pulses, oil seeds, and other crops. The digital platform is being institutionalized by the Ministry of Agriculture to serve as a national seed sector digital platform. And this platform tracks seed demand assessment, variety release and registration, production of early generation seed and the certified seed, seed certification, seed marketing, seed imports and distribution, seed balance sheet. And the other component was on the messaging of nutrition and health issues. We identified key nutrition, food safety, and WASH messaging areas and developed a digital platform. This digital platform is already taken up by the Ethiopian Public Health Institute. The government has already taken it, and we are working on the institutionalization, being with EPHI, Ethiopian Public Health Institute. With regard to lessons learned, we followed country engagement process proposed by the TAC5 triangulation to identify priorities. The desk review provided better understanding of demand and the supply from the CG side. It also enabled quick buy-in of the project outputs because we identified proper priority areas from the government side. We have managed to get a quick buy-in from the government for almost all our outputs, and strengthened ongoing partnership between the CGIAR and the partner or the partners was the other important lesson. This was really a very good milestone. We need to think of this partnership. Next, please. The coordination of the process is a key element, and the plan for management of expectations. We really managed expectations, which was very high at the beginning of the project, and we tried to manage that one. Now we are in line with the government expectations. And we try to align to ongoing country process. It's important to align with what is going on in the country. For example, our plan is part of the RED-FS Rural Economy Development and the Food Security Sector Working Group platform. We have, and the other thing is adequate resourcing is key to support activities and contribute to staff. Next, please. Here are our partners. We acknowledge a very active engagement of our partners from the very beginning of the inception of the project to this time. And next, please. We also acknowledge our funders and core country team members. Thank you very much.
Thank you very much indeed, Getachew. And it sounds like there is seed processing going on behind your house even. So that is the dedication of the team working on its own working plan still until the end of the year. Thank you very much, Ethiopia country team. We are going to move on to another part of Africa, the warm heart, with Wells Kumwenda introducing us results and lessons.
Okay. Thank you so much, Ewan. Welcome everybody to this presentation. I'm going to present on behalf of Malawi. And since my colleagues have already presented the objectives of these studies, I'll just cover the methodology, the results, and the lessons learned. So in Malawi, what we did, we had some consultations made with the farmers, the government, NGOs, and the university and parasitic organizations to identify problems that could be solved with the technologies developed by the CGIAR centers, which we demonstrated to the farmers. So at the end of the day, 8 CGIAR centers, CIP, ICRISAT, World Fish, CIAT, IIT, and World Agroforestry, and IFPRI, they did some studies and then selected the technologies for demonstrations to the farmers, which could improve food security, increase income, and health. These CG centers worked jointly to conduct studies, then train farmers and introduce these technologies that they had chosen. I should point out that some of the technologies, they were left out by the farmers because they were not sure that they would be done within the short period which we had. Study reports were conducted and then submitted reports to government to assist in the long-term planning and strategy formulation. At the end of all these studies, we had a stakeholder meeting, which we had plans which were made for the way forward. Next, please. Next, yes. So what we did, what the results which were achieved are as follows. We had basically 2 activities, the main activities. These activities were based on the ability to provide guidance, improve food security, nutrition, and income in this time of COVID. So we had one activity was updating the sum multiplier modeling of COVID-19 impacts on the Malawian economy, which involved the people who did this one was IFPRI and CIAT plus members of the planning division in the Ministry of Agriculture. They came up with a report which is available. Actually, there are 2 reports available. One is an update on the short-term impacts of COVID-19. And then the second one also is another update on the short-term impacts of COVID-19. These are 2 the reports. 55 staff members were trained from the government and parastate organizations. And a book chapter has been published by IFPRI. You can see some of it from the IFPRI publications. Then we also conducted a seed study to look at how they could be improved, because this was one area which was heavily affected during the period of COVID. But since the COVID was still in progress, we just had to contact the key informants made by phone and also by personal contact, which we did. And then we listed down the challenges which were made by the farmers and also the solutions which were suggested. These have been presented in the report. The next thing we did also was to mount a demonstration of these technologies. And since we were out of the rainy season, these demonstrations were made on 2 irrigation schemes, Bwanje in Deza and Karuea in Nkota. Then on these irrigation schemes, we trained 35 scheme members per site, which were 70 in total. Then these scheme members, together with other people who had received the training, we distributed seed bags to 500 farmers, which has already been done as we're speaking. Then the lessons learned, next slide, was that we found that the CGIAR centers could very ably work together and deliver some solutions to the farmers in the time of this pandemic, like the COVID. Then we also found out that technology transfer is faster if the beneficiaries are put in groups and they have been trained and also shown how to work out their solutions. Like for this case, we had demonstrations on the schemes and farmers could choose the crops which they wanted and how to grow them. And so these were adopted faster. Then we also found out that beneficiaries are more willing to adopt technologies that could help them during the time of the COVID-19. For example, crops which were nutritious were the first priority for the farmers. And also, we found out that the partners who are working already in the areas where we had these technologies, we involved them so that they can also continue the work whenever we are out of the project. Then also, we also observed that the COVID pandemic is still continuing. Therefore, there's need for these activities to continue for the long-term development. Thank you so much. I have a picture here. Last slide, I have a picture here of the farmers who were attending the field day, some of the technologies which we had. Thank you so much. Back to Ewan.
Thank you so much, Wells, also for keeping it short. And we know it is a challenge, and we really appreciate for all of you to try to keep it synthetic. The presentations will be shared along with the results with the recording of this webinar. Thank you. And now, last but not least, the giant of Africa, the other giant of Africa, Nigeria. And we have David Obisean presenting us results and lessons.
Yeah, thank you very much, Ewan. Hello, everyone. I'll be presenting on behalf of the Nigerian team. Please, let's move forward. Next slide, please. Okay, so the CG centers in Nigeria came together sometime in 2020 to formally communicate with the federal government of the country on our plans, interest in COVID-related work. And then we got back, got the feedback from the federal government of Nigeria on areas where they want us to look at and provide some support. Next slide, please. We are given 6 priority areas from improved varieties of crop and livestock fisheries to enhancing the systems, revitalizing the extension systems, to expanding the storage infrastructure, and then empower women and youth, and of course provide social safety net policies. And of these 6 priority areas, we mapped into 4 actually. The first one, 2-in-1, which is improve access to quality seeds, and then improve varieties, which is also responding to the priority areas 1 and 2. And then of course, we looked at strengthening the capacities of women and youth, responding to priority area 5, and of course, generate and provide policy evidence, looking at policy areas 6, 1, and then 2. Next slide, please. So some of the deliverables we were able to achieve in that period under the work plan 1, improving access to quality seeds and improved varieties. We improved the access to pure quality seed and planting materials. We also ensure that planting material distribution to, improve incomes and wealth of farmers, especially in the area of orange flesh sweet potatoes. And of course, we trained and ensures provided seed distribution for OFSP, for cowpea, pale millet, and sorghum. Then the last one we did under this package is sustainable production of chicken enhanced with quality breeds of chicken. Next slide, please. The next package, we're able to train and conducted training and business plan development for women, youth, and then of course combine that with equipment purchase. Then we also trained 250 women to support nutrition and income generation through processing of cowpea, pea millet, and then sorghum. The last one is support and linkages across value chain, specifically talking about OFSP. Next slide, please. The last one is basically looking at surveys. We conducted surveys across fish value chains where 91 actors were sampled, and of course, rural households, over 1,000 rural households. And agriculture provided stable employment in some sectors, building on this for future shocks, priorities for economic recovery, job creation, household assets, and of course, while the COVID-19 rages on, there are other shocks such as inflation, conflict, and insecurity were also affected. These are some of the things where we identified under some of these studies that were conducted. For digital marketing, it was basically found or new ways of doing business, establishing, people becoming more innovative in ways, better ways of doing business, managing the realities, the COVID-19 realities that has come and that's becoming a part of our existence. Next slide, please. There are a couple of key lessons that we learned from this short-term engagement. The first one is, please, just next slide, just press the enter, okay, this engagement and implementation. Under that, we looked at, we saw that building on existing partnerships is very important. Of course, we're looking forward to how the One CG system is going to, transition will affect these dynamics. But we're hoping that the synergy will be there. Of course, also, there's a need for us to build upon the country-generated priorities, which is very important, especially as the federal government of Nigeria is the one that's come forward with some of these key priority areas. For One CG, we hope that we can respond to, but also inform national plans with research findings, and of course, significant coordination costs need to also be looked into, because it wasn't easy in this case, speaking on behalf of IITA and IFPRI, who were joint co-leaders for the teams in Nigeria. And of course, there's a need for us to be aware of focusing and responding to global shocks while not missing out on the local shocks. We're looking at the eagle, having an eagle vision and a snake vision. You don't look at the whole thing at the top and missing out on some of these little key things happening at the bottom level. So some of the key things I want to present for the Nigeria team. Thank you very much for listening.
Thank you very much, David. And with this, we are closing the rounds of presentations. Again, these will be shared with everyone as part of next to the recording on the A4NH page for the Hub. So on this note, we have less time than planned, but still, I would like to invite our partners, Charles Chinkunta from Malawi, Kin Mawing So, sorry for slaughtering your name. My language is not trained for some of your countries. Azam Udin for Bangladesh, and also Karta Kalsa for Ethiopia. If you could just put your video on, and we'd just like to get some impression from you. I'm going to start with a question. It's going to start with you, Azam, because you're the first one to show up with video. What are you particularly proud of hearing the results from what you together in the Bangladesh team have done, and what has been your experience as a non-CGIAR partner in this hub?
Okay, thank you very much for giving me the chance. Basically, COVID have worked with 5 issues in Bangladesh with almost 7 institutions. Among them, 5 institutions have directly worked with Department of Agriculture, means crop production. And CIMIT and CGIAR coordinated these issues. And overall, my experience is, I think it's excellent, because I'm working with digital agriculture of Bangladesh. And presently we are working with farmer database and farmer profiling. We have almost 25 million farm families and 50 million individual farmers in Bangladesh. Bangladesh is a very small country, but our population is very high, and as proportionate, our farmers is also very high. And our plot size is very small on an average, actually. So when COVID started, we are facing little problems to addressing some reporting, some informations from field levels. But when COVID-19 have started its work, then we get some hope to us, because we are little bit slow in digital agriculture in comparison to our digital Bangladesh actually. In that context, we have started a satellite-based monitoring system from, after that we have started stress monitoring from different field level of input items. After that, we have conducted a lot of trainings for collecting this data and for analyzing and how it will reflect in national level, how they will collect the data and how we'll take measures in future. So overall, our experience is very good, and I will say that is excellent actually. And it is now an ongoing process, and hope you will continue your help with us in Bangladesh, and we are expecting to work with you in future with very close and in very advanced level actually. I think it's enough for me. Thank
Great.
you.
Thank you very much, and I'm sure we will actually rebound off on some of what you've offered us. But great to hear that you really appreciated the support, and indeed very important for a very wide agricultural community in Bangladesh.
Yeah. Yes.
Thank you. We have Charles Chinkunta with us. You can, by the way, all panelists, all partners, please keep your video on so that the audience can see who you are. So also Dr. Karta Kalsa and Dr. Kin Maung Su, that would be much appreciated. Charles, any reflections along similar lines?
Yes. First of all, thank you very much for the invitation. Indeed, we benefited a lot as a country from this COVID hub, mainly emanating from the capacity building exercise that was done through IFPRI. I think that is one of the key outcomes of the COVID hub. Of course, the time frame was short. Maybe a lot couldn't be accomplished, but the training on social accounting matrix for the country, I think that is one of the key milestones of the initiative, and also the research activities that have been done. Maybe coming back on the social accounting matrix, it's because at first we didn't have a quick and robust way of determining the impact of COVID, being a new phenomenon. So the capacity building that was undertaken through IFPRI, it has enhanced, the capacity and the ability to be able to quickly determine or model the impact of such a phenomenon. So it's quite enriching and helpful to the government, and we are looking forward to continued efforts and working together in collaboration on the upcoming activities that can ensure going forward. I think overall, this is what I can say.
Right.
Thank you very much.
Thank you very much, Charles. Dr. Kin Maung Su?
Yes, good.
Reflection?
Let me say good day for everybody. Day is better for everyone. So thank you for having this opportunity to explain or some insight from what actually in general, my colleague Dr. Nyong has explaining what we have found on our survey. Actually, this is a collaborative survey together with the IRI, IMI, Wolfish, and the in Myanmar together. And then these are the cumulative outcomes from what we have been doing. The first thing is so that among the results, and then there are a few recommendations and the way forwards I have explained by Dr. Nyong. So I may have to explain a little bit inside what have been happening. The poverty prevalence in Myanmar has been long ago. So, and then for the last government, it has been trying to improve the livelihood status of the people, and as elevation has been a little bit increases. So that, but however, unfortunately, the COVID prevailed, invasion of COVID, then the political impact has been severely, impacted to the food producer particularly. So that the first IFRI has surveying the inside status of the rural people, particularly the poor in the CDZ and ARD Delta. That is almost 75% of the country geography area, has found that most of the people has found so insecure social or physical security, and then scarcity of food particularly due to the restrictions of the COVID, and then social distancing, and then actually the resources used, they can produce more from the agriculture or the fish, no problem. However, there are no buyers. There are buyers, it's difficult to transport, to reach to the consumers. This is problems. But in addition, in combination together, if we look at the yearly, not by the sector harvesting, but if we are looking for the year-round harvesting, it's reach, not impacted to the foregoing years. Particularly, they can produce. However, they have to hold it, they retard it. They cannot produce more because of no buyers. This means no buyers for the fish and the crops, no buyers. And then they are saying that in the Dr. Nyang has explaining that most of the high quality fish has been, the price of the most high quality fish has dropped. The high quality fish, as everybody know, that they are meant for the export market. For that, the export market has blocked for a year or so that there are more suppliers in country that make the prices drop compared to that of our exporters' prices. So this is good for the country people. However, there are another impact that make the transport and the communication hazard could not reach to the consumers. So this is one thing. However, on the other hand, the inputs for the production.
I'm going to have to ask you to be very brief because otherwise we won't hear from our friends in Ethiopia.
Yeah, thank you. Yeah, these are other things. So that there are the majority of the inputs that have been explained by Dr. Nyang, and I will say that it is good that recommendations and the way forward is good. However, I may say that the government has already CERP. CERP is COVID economic plans for the restoration. There are everything inside there. But however, we may need to implement so that if we're going along with this for the future work, it may be good for the way forward with our schemes along with the government status so that we can go. It will be a holistic approaches I may recommend so far. Thank you very much.
Great. Thank you very much indeed. I think that's very much along the lines of what One CGIAR is hoping to achieve. As I'm going to just invite our final partner to give some reflections, I'm also inviting all of you panelists to use the chat to share. We unfortunately don't have the time to do it verbally. I'm really, really sorry for this. But any recommendations that you have for One CGIAR, or also any focus area for ongoing agriculture and food-based support to the national effort to deal with the pandemic as it continues, that would be great. But on this note, I would like to also invite Dr. Karta Kausa in Ethiopia to share any reflections about your involvement in the hub. Yes, here you are.
Thank you very much for inviting me to this important forum. And I want to start with introducing myself. Actually, you said my name, and I'm working for the Ethiopian Institute of Agricultural Research. I'm coordinating the seed sector. So now I want to take the chance to appreciate the effort made by One CG initiative to align its COVID hub with the government plans, which were really previously initiated by the government of Ethiopia to cope up with the pandemic. So as you know, we are aspiring a digital Ethiopia in 2025, and the current contribution of CG results will be considerable. So the agricultural sector actually is a very important component of the economy, and by helping this agricultural sector, particularly the seed sector, which is very important input for the development of agricultural sector in the country, is very important. And the digitalization of this seed sector is also very important outcome that I was participating in. So actually, it's not going to be the end of this result, but you know, further works are required to be conducted. For the time being now, I know the Minister of Agriculture, to my knowledge, has fully endorsed this digitization move of the seed system. So there is a need to work with the Ministry of Agriculture so that it can be part of the agriculture sector improvement in the country. Actually, I want to point out some of the points which are very important to come up with the digitization of the seed system.
Very briefly, Dr. Khalsa, if that's okay, because we have to close also with John McDermott very soon.
Yeah, just some 2 points. Actually, we need to test this seed system, and we have to validate it and improve its constituencies. And also we have to deploy it for use by the actors, and also we have to train the actors to be.
Oh, it looks like we're having an internet connectivity issue. Dr. Khalsa? Okay, maybe some, okay, I think we're going to have to proceed in the interest of time. Again, recognizing really sorry that we cannot spend even more time, but stay tuned for results and more reflections from our partners on the Hub page. On this note, I'm going to hand over to John McDermott, who's coordinating the CGIAR COVID-19 Hub. Some final words of wisdom and farewell also. John, over to you.
Thank you, Ewan, and thank you all for being here. First, I'd like to thank the country teams and their partners. I think from this webinar, you've seen some very practical responses to country demands that have been implemented rapidly over the last 12 to 18 months. It's very impressive. These country teams were supported by a working group looking at country responses. And it was a team that was led by Oluchi, by Tom Randolph, and initially by Katia Kravonos of the System Office. And one of the things the working group did was to provide a very systematic approach to the country teams to engage and support partners. And I think that approach really recognizes the central kind of ownership and leadership of countries in responding to COVID and other crises, and also in the long-term food system transformation that you've heard about. And it's really critical that that we respond to the diversity of priorities and the capacities of countries, because that's where things get done. And this is certainly a process that CGIAR can build on in the future. The webinar that you've heard has been recorded and will be on the CGIAR COVID page on the A4NH website. I have pasted the link in the chat. And thank you all for joining us. Have a rest of a good evening or day. And thank you so much for being with us. Goodbye.
Thank you very much, John. And thank you very much, everyone, indeed. Country teams, partners, everyone. Have a good day. Have a good evening.
Bye.
Good evening.
And the effort continues.
Thank you so much, Ewan. Thank
Bye
you,
bye.
everybody. Thank you,
Have a
John.
good day. Bye.
Bye.
Good afternoon. Good morning.
Bye-bye. Bye-bye.
Bye,
Thank you.
bye. Thank you.